Here are updated statistics on confirmed coronavirus cases as of last night. Here's what we have. New daily cases in the United States, 71,321, with 399 new deaths. Total cases in the United States, 9.4 million, with more than 236,000 deaths and more than 6.1 million who've now recovered. Total cases worldwide, 46.8 million, with more than 1.2 million deaths and more than 33.7 million people who've beaten the virus globally. Dr. Kevin Kavanagh is our go-to guy when it comes to coronavirus. Good morning, Dr. K.
Good morning, Jack.
How are you this morning?
Very good. We should have an extra hour every Monday. I think that would be a good platform to run on.
I love the way you think. Let me tell you this. I tell you what I'm really looking forward to is Wednesday when the coronavirus goes away.
I am too. In fact, I was going to mention that to you, that probably this is my last day because after tomorrow, there's no coronavirus.
That's right. And there'll be no more Dr. Fauci either, apparently. I guess you heard that.
Yeah, everything's just disappearing. Yeah.
Exactly. Now I hear that Europe, much of Europe is now on their second or getting into their second lockdown.
That's correct. Their cases are spiking. They are locking down again to try to get a hold of the virus. In other words, you can gear up both your hospitals, gear up your PPE, gear up your contact tracing, your testing, etc. during this time of lockdown. One of the problems we have is if we were to lock down, then what? We're not gearing up much to do anything. From what I've heard on the media, the White House has pretty much, the virus is going to do what it's going to do. We're going to focus on the vaccine. So the idea of a lockdown is to have a plan to take that time to gear up so you can better battle the virus when you come out of lockdown.
I want to ask you about this because I saw this over the weekend. The president is running an ad right now that says that doctors are profiting from diagnosing COVID-19. That's why they're doing it. Do you even know what he's talking about?
Well, unfortunately, I've heard the ad. I have no idea what he's talking about. I think that this is another example of misinformation. Doctors do not profit from diagnosing COVID-19. There is hospital billing which can take place. When that billing occurs, they can diagnose COVID-19 and maybe get a higher payment. I think they get about $2,000 more. But that doesn't affect the doctor. The doctor is paid by procedure. Hospital billing, hospital diagnoses, that's called administrative or claims data. They are not used much anymore for epidemiological studies, and for COVID-19, it's not used at all. The doctor diagnoses the case, it goes to the health department, and the health department then performs an investigation. The hospital's completely out of the loop. The doctor gets no extra money. This is absolutely false news. The other thing in the statement that just drove me crazy was stating that some people are actually dying of heart disease or dying with cancer when they have COVID-19. I mean, I'm sorry, Jack, we've talked about this before. COVID-19 is as much a heart disease as it is a lung disease. Recent study out shows that 62% of patients that are hospitalized have elevated heart enzymes showing myocardial injury. They have increase in thrombosis of the blood. They get heart attacks directly from COVID-19. They get a myocarditis directly from COVID-19. This is a heart virus as much as a lung virus. So of course people die of heart attacks. That's what COVID-19 does. And believe me, if you have cancer, you can still die of COVID-19. I mean, it makes no difference if you have cancer and we're going to die some years later or sometime later. If you have COVID-19 and you have significant symptoms and you die, that's a COVID-19 death. Let's face it, if you had someone on COVID-19 that was riding on an airplane and that airplane crashed, you wouldn't hear the airline company saying, well, we didn't actually lose 200 people. We only lost 180 because 10 of them had COVID-19. We don't do that in America. That's not ethical. So to me, that is just wrong messaging. This is a serious virus. We need to take it seriously.
Very happy to talk to you as always. Thank you very much.
Thank you,
Kevin
Jack.
Kavanagh. Talk to you on Wednesday. Thank you.